This is Dr. Shakil Ahmed presenting a short video about logical interpretation of ultrasound images. This image belongs to a patient with postprandial pain. The laboratory values were within normal limits. The query is that this anechoic mass which is appeared here, what to be considered? First of all, coliacal cyst. Coliacal cyst, that is mean a cyst which is attached with the CBD. Here it is less likely. The second option is simple hepatic cyst. As you know, this is anechoic. The wall thickness is very thin or invisible. It is likely to be simple hepatic cyst. Option number C is abnormal lymph node. The node will appear with a Hilus sign in the center. So it is not a case of lymph node. Second, the site for the lymph node is not the proper one. And hepatic artery aneurysm, that is less likely because it is not connected to any vessel. Case number 7. This is the image of a patient with ascites. This linear hyperechoic is visualized, and here is the query that what is this? There are 4 options given. One is coronary ligament, the other one is venosum ligament, falciparum ligament, and triangular ligament. First of all, the falciparum ligament attaches the liver to the anterior abdominal wall, extending from the diaphragm to the umbilicus. The ligament venosum separates the left lobe of the liver from the caudate lobe. The triangular ligament is the most lateral portion of the coronary ligament, which connects the liver to the diaphragm. Let's have some details. The anterior surface of the liver is smooth and molds to the diaphragm and anterior abdominal wall. Generally, only the anterior inferior edge of the liver is palpable on a physical examination. The liver is covered with the peritoneum except for the gallbladder bed, porta hepatis, and the Beer area. Peritoneal reflections from various ligaments that connect the liver to the diaphragm and abdominal wall, including the falciparum ligament, the inferior edge that contains the ligamentum teres. This is the inferior edge, and the obliterated remnant of the umbilical vein. This image shows the liver inverted. The structure in the porta hepatis includes the portal vein. This is the portal vein, hepatic artery, which is shown as red, and the bile duct, that is here. In this image, the liver is attached to the posterior abdominal wall and diaphragm by the left and right triangular and coronary ligaments. This is left triangular, this is the right triangular, and these are the coronary. The falciparum ligament attaches the liver to the anterior abdominal wall. Beer area is in direct contact with the right adrenal gland, right kidney, and IVC. Posterior view of the liver shows the ligamentous attachment, while these may help to fix the liver in position. The diaphragmatic peritoneal reflection is the coronary ligament, whose lateral extensions are the right and left triangular ligaments. Falciparum ligament separates the medial and lateral segments of the left lobe. This is the triangular, this is left one, this is the right one. These are the coronary and the falciparum ligaments, which also the lower part is called ligamentum teres, that is separating the right and left lobes. Case number 8. This image belongs to a 40 years patient with history of gallstones, complains of fatigue, fever, chills and loss of appetite for 1 week. Laboratory tests showed marked elevation of AST, ALT and bilirubin level. So based on the clinical findings and the image findings, what is suggested? First of all, candidiasis, acute hepatitis, fatty infiltration, portal vein thrombosis. The liver's parenchyma appears slightly hypoechoic with prominent portal triads, which appears to be starry sky. The patient's clinical history, along with these sonographic findings, are most suspicious for the option number B, which is acute hepatitis. The candidiasis is a fungal infection more commonly associated with the immune compromised patients, demonstrating uniform hypoechoic lesions on ultrasound. The portal vein thrombosis will be appreciated as tubal structure containing the thrombus, while the fatty infiltration, there will be hyperechoic liver. Thank you very much for watching.